I think I don't have to revisit the stability table with the Osstell, but this table has been developed over time, with reference to over 1,200 articles that cite information on the RFA and ISQ outcomes, and we work within this. But one of the key factors to understand is the biggest change in stability occurs between 60 and 70. And I sometimes have to talk to our residents about that, because they will write in their chart notes, Osstell implants, 60s, right? Or the range 60s to 70s. That gives us nothing. I mean, if you really want to chart the stability of an implant over time, you need to have the actual number, because there's going to be a difference if something's at if an implant's at a 60 and it goes up to a 69 versus it's at a 60 and it drops down to a 58. These are things that we want to keep an eye on. So we just don't generalize these numbers. We actually want to record them as is.